Hello, Traverse City Christian School community and those on Facebook. Thank you for watching into what is a new video series that Traverse City Christian School is starting, and it's called Your Turn. And what we're doing is just inviting different guests onto this video series to share their perspective on and insights on their maybe role or their job as to how it's maybe being affected by coronavirus. So we've been able to have a discussion with Congressman Jack Bergman, and also had a conversation with Pastor Anthony Weber and life coach Terry Porter. And today we're going to get a perspective and a conversation from someone in the medical field. And so it's great to have Dr. Nate Saylor here with us today. Nate Saylor is he's a dad of 3 boys that are at Traverse City Christian School. He's on Traverse City Christian School board, and he's also a doctor in family practice in Kalkaska. So Nate, thanks for joining us today, and appreciate you hopping on here with us.
Yeah, it's great to see you, man.
So obviously in a medical profession that you're in, a lot obviously has changed over the last few months, but there obviously too was conversations and changes and preparations that you guys had to make in Kalkaska, where you're at, for COVID-19 response and just getting ready for that. So can you kind of speak on what did the conversations look like? When did they start? And what did that preparation look like as you began to see the virus move to the States and then to Michigan specifically as well?
Yeah, great question. It was definitely an evolving conversation. I think a number of us were watching the news just like everybody else and kind of seeing what was going to happen with this viral outbreak that started in China. And then as it progressed through Europe, even as we saw things kick off into Italy, where Italy was hit pretty hard by the virus. I think that's when we started really thinking that we need to start making a plan, because this is probably going to get here, or maybe it already is. So I think as far as timing, I don't know exactly when we started those conversations, but it was some point around the end of January, beginning of February, where I think hospitals, at least in this area, started making plans to see how we were going to function and how we would adjust and adapt to dealing with the virus or a pandemic. I've never seen a pandemic in my lifetime, career, or training, and we haven't really had one for many, many years in this area anyway, for sure. So it was a learning experience for a lot of us, as far as how do you still treat people who don't have the virus? How do you treat people with the virus without becoming infected yourself? How do you avoid an onslaught of patients who are sick hitting the hospital at the same time? And then what happens if your entire emergency department staff becomes infected, or your family practice staff becomes infected? Then who's treating patients and who's refilling meds? And just a lot of those big questions on top of what is coronavirus? How do we respond to it? What are the best treatments? What can we glean from what's happened in other countries who have been hit ahead of us? What are things to try and not try? So a lot of it was an evolving conversation, and even it's still evolving, where we're trying to figure out the best way to manage patients who are sick and also manage people who are well without cross-contaminating the two. So as far as conversations, it's still an ongoing conversation. Definitely one that we're going to keep thinking about, and as more data comes out and the numbers are analyzed and thought through, I think it helps us with a better response, a more guided response, as far as even treatment options. There's a number of different medications and therapeutics that are trialed, and with a pandemic, it's rare to find, all of a sudden bring up a new med that's specific for COVID virus, for example. It's easier to start with medications which you already know their safety profile. And so we start using them theoretically based on theory and based on what we know about coronavirus in general. And then seeing how those medications work in hospital settings, or in sick patients, or even treating people who are ambulatory. They're not quite to the hospital stage yet. And that's what we've been seeing with a number of different medications. There's definitely a lot more that we know now than we did as far as options for patients and how to treat them. So yeah, it's an evolving conversation that's started back in January and has continued on.
Yeah. And how about for some of the, PPE is one item that a lot of people are talking about right now. What did your supply kind of look like before COVID-19 came, and how has it been since it's come to Michigan?
Yeah, so thankfully now it's a lot better than what it was. We had a really good system before COVID-19, but then because of the pandemic, and just a worldwide use and then subsequent shortage of masks and gloves and gowns and PPE. For example, like kind of anecdotally, it wasn't exactly like this, but the idea was we had a normal order that would come in monthly or quarterly of our PPE. And let's say it was supposed to be a semi truck full, and essentially we'd get like a pallet. So in the very beginning, it was pretty scary actually of how little PPE there was, which we're not in that situation now. You know, the national stockpile has been built back up, and most hospitals have enough PPE or have at least ways of getting more now, especially as local companies, even in Michigan, have started pumping out gowns and masks and surgical supplies and gloves, so that there's definitely more materials available now than what there was. It also provided, in a positive way, it provided a chance for the community to surround their local hospitals. And it was really cool to see in the very beginning of February and March, we had people coming up to the hospital just dropping off boxes of unopened gloves or masks, and it was heartwarming to see the community surround, you know, their local hospital, and really people reaching out for their own community to help out with providing things that they didn't use. I had a friend who, or several opportunities like this, or several examples like this, where people just said, "Hey, we had these N95 masks. We use them for drywalling this last year, but we haven't used them. They're unopened. Can you guys use them?" And it was really cool to see how the community really bridged that gap between when we ran out or were about to run out to the point we are now, where we have PPE and hospitals are building their supplies back up. The other thing that has happened since then that's been pretty cool too is figuring out how to reuse and repurpose PPE, really decontaminate it without ruining it. And so we have procedures now where we can reuse some of those masks before they were tossed right away when we had plenty of them and weren't using them very much. But we have procedures now in place where you can repurpose the masks and redistribute them after decontaminating them, and continue their use and prolong their use. So that's kind of a cool thing that, as a result of something negative, something positive came out of it.
Yeah. So that would be something even going forward now that hospitals have learned how to repurpose them and clean them so they can be used more than one time then?
Yeah, I don't know if it's going to be something that'll be put in daily practice, but at least if we have another outbreak of anything, we have ways of preserving what we have and not just running through it in the first couple of weeks and then being like, where is it? So I think it's a lot of knowledge that has been helpful, and a lot of work that's been done trying to figure out the best way to do it. There's several things. I mean, I'm sure you've read or maybe have heard of people even in the community trying to figure out, how do I reuse my mask? Well, if you bake an N95 mask in an oven, for example, it really breaks it down, and so it loses its effectiveness. But there's other ways that you can decontaminate it, and they've kind of employed some of those in our hospitals. Even in Munson Healthcare has a way of doing that. So it's helpful to have that in your back pocket if there's another pandemic or if the pandemic worsens here.
Yeah, that's great. Yeah, you mentioned even just the community outreach of kind of partnering with the hospital, whether it's in Kalkaska or in Traverse City, or you hear the stories nationwide too of people just stepping up and helping. Whether it's that or other things related to coronavirus, just based on the response, what things have you seen that have gone really well, or encouragement just over the last couple of months, as you've seen the virus make its way here, that has been positive things, I guess, on how the response has gone?
One thing that for sure makes me thankful is the fact that when you look at even just the numbers locally, of how many cases we've seen, how many people are tested. I think I'm going to speak generally because I don't have the exact numbers in front of me, but around 5,000 people have been tested, and there's around 300. But thankfully, of that 300, that population of 300 who are positive, there were only, I think, about 17 to 20 deaths, which is still tragic if you're in one of those families and you know someone who has died because of coronavirus. But I think we can be thankful that at least we haven't seen some of the numbers we've seen in other places, as for sure in more urban settings where there's a higher population density, the outcomes are not as positive as ours. So I'm thankful, number one, that we haven't seen the pandemic, quote unquote, here as much as it's been seen in other places, other cities. And then two, I think the positive things that we've seen, I alluded to them earlier. One is just the community surrounding their local hospitals, and even healthcare providers. Lots of stories of even my coworkers, nurses, and medical personnel, and physicians, and PAs and nurse practitioners, each having stories of friends or family members, or even random people who have just reached out and dropped off masks or said, "Hey, I'm praying for you, or I'm thinking of you," sending them notes of encouragement, sending them cards. Kids coming out and writing on sidewalk chalk in the parking lot of hospitals, like, "We're thinking of you, we care for you." Just things like that. It's a very positive feel, and it's heartwarming to see people looking out for each other. I think that this virus response, well, the virus is awful, and there's a lot of things we could talk about. Just seeing how there has been a lot of unity, and it have been a lot of people coming together to work with the same goal of beating this virus and encouraging each other has been really cool. The other thing I think that is really important and has been nice to see is, oftentimes, just like in any other industry, in healthcare, it's no different, where whether it's real or perceived, there's sometimes an animosity maybe that's felt between administrative staff and clerical staff, or kind of the boss and the mid-level guy, or however you want to phrase it. And it was really cool to see how hospital staff, administrative personnel, and clinical personnel really came together to share their strengths and develop a team approach to how can we best make this happen. As a physician, I know how to treat disease, and I have a lot of ideas of how to keep people from getting sick and how to treat those who are sick. But I'm not a logistical operational guy. That is something else, a set of skills that I don't have and haven't learned yet. And so I need the administrative staff to really facilitate and help with the logistics of how we're going to make these changes and how we're going to move forward. And it was cool to see that happen, where instead of sometimes that perceived animosity that's felt, it was pretty much gone, and people were really arm in arm, locked together to fight against this virus. Something that I think you and I have probably read about when it comes to how the U.S. responded in World War II, where automakers switched from making cars to making airplanes. And similarly here, we have automakers who have switched from making cars to making ventilators, or hockey companies, Bauer, one of them, I think they started making face shields, and Sims, who makes waiters, started making gowns. It was really cool to see just local companies change over it and work together to fight this virus. So I think that's another positive amidst all the negative.
Yeah, it was incredible to see those different companies. I mean, even how quick that they could change their operations to be putting out these different materials to get them in the hands of hospitals so quickly, even though they weren't, initially set up to be making those things. Obviously, it was a pretty quick turnaround, all things considered, to get them into the hospital hands.
Yeah, for sure. And it's really cool to see even too, I mean, how not only just turning over and making ventilators, but even looking at the ventilators themselves and saying we can make a better one. So even pushing the technology further ahead. I mean, nothing pushes it like this kind of pressure.
Right.
So that's been kind of cool to see too, where people are thinking about things they haven't thought about, or improvements that we wanted to make that hadn't made them yet. And this was really a push where people could use their ingenuity to improve on a project that's already pretty good.
Yeah, that's great. One thing, Nate, that we see if you on social media or on the news, there's a lot of different, every day it seems like another article about whether it's PPE, how to use it best, or the vaccine, social distancing, what works, what doesn't work. And it's hard to know, is it over here? Is it over here? Is it somewhere in the middle where the truth lies? But what would be some of the, I guess, common misconceptions that you see out there, or when people ask you questions about COVID-19 and different things related to it, are some of the common questions that people are really wondering on because they're really just not sure what to think about it?
Yeah, another great question. I think the way that the one word answer to that question is the word nuance. And I feel that nuance is an appropriate description of really, at this point, what we know about coronavirus, because nothing is simple, nothing is black and white, if you will. It's complicated. There's a lot of data that's coming out daily, but that data is raw and needs to be examined with a close eye and with skepticism, and tested. And I think that unfortunately people are on both sides of the issue want to jump on one study or jump on one set of data that they've come across, and they share it with everybody, and then that's how these misconceptions really get fuel for the fire. And so I don't think it's as simple as, there's I guess two big misconceptions really that we come across on a daily basis. One is the person who says, I'm not leaving the house for the next 2 years until there's a vaccine in place. And I think that's a misconception because one, this virus is likely to be around for a lot longer than that. And two, even if there is a vaccine, there still has yet to be a vaccination that's perfect. They're very good. Many of them are really, really good, but nothing is perfect. And so I think relying on that false sense of hope maybe is exactly that. It's relying on a false sense of hope. I think that the other side of that coin is that there are a lot of things that we've learned about coronavirus, one of which is we have ways of treating it. Those are still being tested. But as time goes on, we'll have more therapeutic medications and treatments available that will help treat people who come down with coronavirus. And so I think, yeah, waiting and holding up in your house because you're living it out of that sense of fear is unhealthy and unrealistic. I think that you could wait for example, you could wait 2 or 3 years and never leave your house, and then you come outside and you could get sick with something. At some point, that theory doesn't work. So the other misconception is that people say, well, I'm not even going to worry about it. I'm just going to go about my day to day and live my life how I want to live it. And I think that's unfortunate because there are people who are susceptible to this virus. And I don't think as Christians, we can neglect the fact that we are called to love our neighbor as ourselves, and we're called to care for those around us, and really care for those who are in a situation that may be different than mine. People who might be more at risk and might be more susceptible to the disease than me. But I have a responsibility as a Christian to look out for their needs and do what I can to help protect them. And so if that means, I have to wear a mask certain places or wash my hands 15 times more a day than I usually would, or have some social distance, or instead of a face-to-face visit, I might have a Zoom meeting, so be it. There's a call for humility and a call for self-sacrifice that as Christians we signed up for. So I think some of that has to be taken into balance. As far as the misconceptions, that it's definitely a problem. I don't think it's as severe as some people want to make it sound. It's not Ebola. It's not a disease that it's still, even as bad as it might be, its mortality rate still very low when it comes to coronavirus. So your chances of surviving it are still very, very high. And I think there needs to be just a wise sense of balance and a sense of humility as we respond to any data that comes out, and as well as how we respond personally to governmental guidelines or restrictions, etc.
Yeah. As we were talking earlier about this one, and I appreciate your take on it of when you see the new information, whether it's an article on Facebook or online, your immediate response isn't to, put it back out there on Facebook. It's maybe you sit on it for a couple of days and you do some research and okay, where does it fit with me? Where does it fit within, the grand scheme of all this? Before just putting it out there, you really reflect yourself before just spewing it out again.
Yeah, exactly. I think spewing it out is a great word, because sometimes that's what it is. And it's interesting too. I mean, you'll see something that's shared 1,000 times on Facebook, an article or a video or whatever. And then a week later, that same article is almost completely debunked. And I think that's a good, something that we can learn a lot from. And that is, don't jump to conclusions. Again, there's nuance. Nothing is simple. Nothing's black and white. So really think hard about, where is this information coming from? What's the bias behind it? Who's sharing it? Where is it coming from? What's their reason for sharing it? Why are they so adamant to share it? Not that you can't share anything, and we have the ability to talk and think. And I think that's good, that we should have open conversation, but it should be open conversation where you're thinking and you're really not just jumping to conclusions, and you're willing to examine things with a close eye. And look at it closely. And even, when it comes to new medicine hitting, when the new medicine that hits the field, that medicine has been rigorously examined for safety data, for how effective it is, if it's better than placebo, if it's as good as placebo. There's a lot of time and thought and energy that goes into figuring out if this is really a good, solid, safe treatment. And at a time when there's a virus response, the tendency, or maybe the temptation is a better word, is to really get things going and move things out and get new medicines, for example, that are going to work. But the risk that you have in that is that we rush to conclusions that aren't really true. And I think whether it's a medicine or anything, we need to examine the information before we push it out to everybody else. I think the verse I'm trying to remember that I should know the reference, but it's the verse that says we should be quick to hear, slow to speak, and slow to anger. And I feel like that could really, if I would listen to that and put that into my own life a little bit more, I would be a better Christian, but also a better physician, better father, better husband, everything.
Mm-hmm.
If I would just be quicker to hear and slow to speak and slow to anger. And if we could let that guide us when we're reading Facebook posts or Instagram posts or Twitter or tweets, that would probably, we'd all be in a better situation.
Yeah, definitely. One follow-up question on the vaccine, when you brought up earlier, where, just because that's another thing, I think I see a lot of different timelines on where things are at with that and when an expected vaccine would be available. What's the latest that you hear on when a vaccine would be available for COVID-19?
So that's a question that's really hard to answer, because I feel like as soon as I hear something and think about it, it's already changed. So I'm hesitant to give like a date.
Yeah.
I don't know is the best answer. Usually I think an average it takes about 18 months on a fast track for a vaccination to be approved. And that would happen in this situation because the FDA has been putting through some emergent guidelines, so trying to get something in place for a vaccination. But there's several things to think about. Number one, if there is a vaccine and they're going to push it through emergently, generally, and again, this is general, so this could totally change, but generally that vaccine is going to go to the people that are at the most high risk first. So it's not going to go to the general population. We have examples of like pneumonia vaccine or a shingles vaccine. It's going to people who are older and who are more susceptible to those diseases, those outbreaks. It's not going to kids. I should say there's certain pneumonia vaccines that do. But generally, it's people that have other medical conditions that would put them at risk for those infections. And I think that's probably going to be the same way. Again, this is my speculation, that it's probably going to be the same way with a coronavirus vaccine. If it does come out, it's likely going to go to high risk populations first before the general public, and it's going to be studied for a while before the general public. And then, so as far as timeline, generally it's at least 18 months. And I can see that being likely true in this situation, although there may be some early studies where people are able to get something a little sooner. I think that's probably a fairly safe bet. And the other thing to think about is that the virus or the vaccine not only going to high risk individuals first, but number one, we don't know how long your immunity will last from the vaccine. That needs time to figure out, like post-marketing surveillance, if you will. So whether it lasts for a year, whether it lasts for months, whether it lasts for 2 years or a lifetime, we don't know. And so that's going to be information that will have to be further determined once the vaccine is released.
Yeah. I don't know. It's a great answer right now. I have that a lot with school too. What's school going to look like in the fall?
Yeah, for sure.
I don't know right now.
Again, that goes to the whole nuance that there's a lot of information coming out, and there's just so much of it that we have to go through. It's kind of like drinking from a fire hose, but we have to step away from it for a minute and think about what we just ingested, because there's so much information coming out so fast. It's hard to know what to believe and who to believe, and that's a struggle that all of us feel, I think. But the reality is that I think as Christians, we also have that true hope that God is in control. That's never changed. He knows the outcome of this whole thing. He knows if you or I are going to get coronavirus and if we're going to survive it, just like he knows the day that we'll take our last breath. So I think as Christians, we can be wise and we can be skeptical and we can be humble and we can be thoughtful, but I don't think we have to be afraid, because we have a maker who's in control and who knows the outcome.
Definitely. Great point. So we're coming off of Memorial Day weekend, and obviously Michigan has moved to its regional reopening phase approach, and Northern Michigan is open, in part. So as businesses start to reopen and churches, they're in different spots of opening and having in-person gatherings, and as us at TC Christian, we look at the fall as to what that might look like. We're starting to develop plans for A, B, C, and option. What are some of the, main things you would continue to stress to people as things continue to open over the next while, as churches start to gather, and as even us as school, as we start to look to get back in the fall, in order to, make sure we're doing our part, but also, start to go out because, we want to start getting out of the house too.
Yeah, I think everybody's feeling cooped up. I definitely have the worst case of cabin fever that I've ever experienced in my lifetime, and I think everybody
Mhm.
feels that. My kids for sure feel that.
Yeah.
Um, so I think all of us are eager to get back to not having church on Zoom and having church in an actual room,
Mhm.
and looking forward to seeing our friends and family members. And I think we probably all have experienced a little bit of that over this weekend. Maybe not everybody, but a lot of us have. And
Mhm.
so I think there's some general rules just to keep in mind. One is be respectful of others. If somebody wants to wear a mask, I think that's okay. Let them wear the
Yeah.
mask. And if there's somebody who says, hey, if you're going to come see me, I prefer you to wear a mask. I guess to me it's an easy fix. The relationship to me is more important than
Yeah.
how I may disagree or agree with mask wearing or face covering wearing, for
Mhm.
example. I think the other general principle that's important to keep in mind is to wash your hands.
Mhm.
This is just another this pandemic has been another example of why hand washing is so important.
Mhm.
And I think that sometimes people have this false sense of security if they put gloves on. I went to the store today and the cashier wore the same pair of gloves. He touched probably 10 or 15 different items from
Yeah.
different people. Never changed the gloves, so it's just a false sense of security. The cross contamination that happens with glove wearing is really high, especially if you're a person who's not really trained in how to properly wear them or use them or
Mhm.
take them off or put them on. So I think that can be fixed with washing your hands as much as possible. And Yeah, I guess I don't know if I'm answering the question or kind of getting to where you're going for. I think churches are still answering the question of how they're going to get back together. I
Yeah.
know our church has talked about that too, of trying to figure out who's comfortable coming into the building, who's not
Mhm.
comfortable. Do we have outdoor services, indoor services? I think currently, one thing to keep in mind, and I think it's important to remember too, that while there are restrictions on church gatherings, they're universal. Our state government, at least in Michigan, has not been targeting churches, where it's
Mhm.
reopening other places ahead of them. And so I think for Christians, we just need to practice some patience. I don't think there's active discrimination against churches currently. The guidelines are universal for everybody. And that's one important thing I think to keep in mind is that we need to have patience. It's going to be slow, but
Yeah.
eventually we'll get there. And I think we need to use that as an opportunity to practice patience, because that's a commodity that I don't have a lot of, and I know others don't either, personally. Um,
Yeah.
and even yeah. So I guess that's the other thing is just is be patient, wash your hands, and
Mhm.
be respectful of the needs of others. I guess I'd sum it up that way.
Yeah. I think that's one of the the things that's going to definitely come from this is the importance of just great hygiene, washing your hands in general. That maybe we're getting a little lax, and you said a false sense of security that I don't have to wash my hands as much as I maybe think I do. But yeah, that's just even more so magnifies the importance of doing that and making sure that after all this is starting to dissipate as well, that everybody's got to do their part to make sure that it's quelled and stays down too.
Yeah, it kind of anecdotally, there are several hospitals you can look at public information, but of how much hand sanitizer they went through in the first month of response, and it
Really?
makes you kind of wonder, like, why did you triple the use of your hand sanitizer just in 1 month? But I think it's because of that we become lax, and you
Yeah.
just don't do things like you should sometimes, or people cut
Mhm.
corners. So it's a good reminder.
Yeah. Yeah. So going forward for your work and hospitals in general, what things? I mean, maybe it's triple use hand sanitizer going forward is going to be what the norm is. But what other things structurally within hospitals maybe do you anticipate or have you guys already been talking about as to how to structure the hospital itself? What the doctor patient interaction looks like? I know some they're doing the video conferences for some of their meetings with patients from at home. Is that something that would be more the norm? Guess what does it look like going forward in hospitals after this?
So I think, yeah, the first one, and actually it's a great thing. It's really allowed virtual visits to become a normal thing.
Mm.
And it's technology that a lot of places needed to happen. Actually, the hospital that I'm a part of is a rural health clinic. And the rules for rural health clinics are a little different. They're usually more strict as far as what we can and can't do. And they're set up to really support populations where there's a low socioeconomic status, or there's people who have or there's a lot of patients who don't have insurance or have state-sponsored insurances, which don't reimburse typically well, and so they are limited to specialists and consultations, et cetera. So a rural health clinic is set up to treat those populations and help provide care for those patients. as such, they're a little stricter, as I mentioned. And we've been pushing for virtual visits for a long time, and just, it's kind of come up against the bureaucratic wall. But all of that red tape was lifted, and it's been a really cool thing for a lot of patients who have transportation issues or are older and just have a harder time making it to appointments, or they miss an appointment and you can still catch up and see them and check in on them. So I think that's a really cool thing. That option is definitely going to be here, and hopefully for a long time to come. I think, the other thing that's pretty obvious is less visitors in the hospital and to appointments. So really being a little bit more picky about who's able to come in and when they can come in and how long they can stay. I know, Munson Healthcare has on their website, there's guidance for, depending on where your family member is at, whether they're in the OB ward or the ICU or the waiting room or the ER. There's different guidelines for how many people can come in. And I think that's probably going to stick around. I think you're also going to see, you're already seeing just an emphasis on spacing between people. So you might space out procedures. So they might cut down the number of MRIs you can do in a day because you're spreading out the time in between each case. Surgical cases, the same thing. Having extra time in between patients to decrease cross-contamination. As well as even in waiting rooms, setting up, I know our waiting room has been spaced where people are 6 feet apart, and really emphasizing not having people sit in the waiting room. So doing the best we can to have people come in from their car or their vehicle, they check in and they're pretty much taken right back to a room, and limiting exposure of large groups of people sitting together. So I think those are actually good things that have pushed us to do that. On the negative side, you're going to see a backlog. So I know even currently, like people that were scheduled for their knee replacement, for example, 2 months ago, they're all having to be rescheduled now. And it's just going to take a while to get through the people who are already scheduled on top of the people who still need to be scheduled. So that's something else that you're going to see. Even in our clinic, there's been some creative thinking where we were able to divide a third of our building. And so anybody who has any type of infectious symptom, like a cough or a sneeze or a fever, anything that might be deemed infectious, can either schedule to be seen on that wing, or there's a screener that's in the parking lot that screens every patient that comes to the door. And if they have infectious symptoms, they're moved from the general area to the that third of the building that's dedicated for contagious patients. And then they're brought right in from the car to the room. They're seen by a provider or providers, and those medical providers are always in full PPE. And then they're treated and they're taken right back out to their car. They don't have to check in. They're never in the waiting room. So they're really decreasing cross-contamination of contagion. And it's been pretty effective as a way to treat and test people who otherwise wouldn't be able to come into the hospital or would have to go to the ER. And that further, clogs up the exposure for the ER personnel and the patient. So some creative things like that have happened in a lot of clinics in Northern Michigan where they've tried to, divide and conquer a little bit. And I know in Kalkaska specifically, it allowed us to test patients earlier because we had a way to see them instead of, the mantra initially from the state was, if you have symptoms, stay home, which is still a good rule of thumb, but some people need to be seen and they weren't sure how sick they needed to be before they came to the ER. So it was a way for us to see them. They really had minimal contact, and it also was a way for our staff to use less PPE because that physician or the physicians or care providers, nurses, et cetera, there was a limited personnel in that 1/3 of the building, that dedicated wing. And so they were in full PPE, but everybody else wasn't. And so it was a way to decrease the use of PPE during the time of the shortage. So things like that, I think, are going to be seen, where you might have a little bit more inconvenience to your visit at times, but still trying to figure out creative ways to see people and keep them healthy.
Yeah, I mean, when you were first describing it, of just a different, if it's less patients in a particular time span, and having the distance, it's like that sounds like it's going to be a longer drawn out process. So you won't be able to get in as quick. But I mean, it's great to hear there's different creative ways to try and get around some of that to still meet people's needs, whether it's first out in the parking lot and get them directly in. So yeah, I mean, there's going to be maybe a little slower process, but that hospitals are looking at ways to, obviously, if you need help, we'd love to get you in as quick as we can too.
Yes. I mean, I think the biggest worry right now, not the biggest, but one large worry that a lot of us have is we're worried about the patients who are too afraid to come to the hospital when they need to. So patients that are sitting at home and they have, a coronary artery that's nearly blocked and they're waiting it out, it's not going to be a good end to that decision. So we want to try to make ways for patients to be seen, but like you said, keep them safe at the same time.
So what is like the next couple months, now that some of those surgeries that you had mentioned can start to get rescheduled, and at the same time others who maybe were planning on doing one over the next couple of months, what does that look like scheduling wise? Is it just working through it as best you can, knowing that there's going to be a lot of people that are now going to be wanting those elective surgeries?
Yeah, I think that's exactly what it is. It's just trying to start at point A and get to point B, and you've got to take the steps in between. So currently, I know that a lot of hospitals, Munson has employed like a callback list. So patients who were scheduled initially are just kind of they're moved back, and then they're calling them now and trying to reschedule them and fit patients in when they can. So it's just going to be a little bit of catch-up mode, if you will. But I think that's to be expected, and people have been very patient and understanding. I think we all understand. None of us want to jump the gun or jump into something too soon, and I think that's a fear too. So we want to be wise and do the best we can. Prioritize the patients that are the sickest or who have the most pain or et cetera first, and try to get those patients taken care of, and then move on to move down the list sequentially, kind of in a triage form a little bit.
Yeah, great. And this last one, I know you've kind of mentioned it or touched on it throughout this already. A Christian response to it. You mentioned the verse of quick to listen, slow to speak, slow to become angry, loving your neighbor. If it's a sign of showing respect right now, if they would prefer you wear your mask, that's an easy thing we can do that shows we're loving our neighbor, and also doing what we can to be socially distanced, washing our hands, all those sort of things. But what other, I guess, mindset items or perspectives would you want to share on how we as Christians should be responding during this time to coronavirus?
Yeah, I think there's a lot of different articles that I've read and others who have said it a lot better than I can say it. But I think there's a couple things. One, I think I alluded to this earlier. It's a chance for me to model self-sacrifice, kind of a mask situation like we mentioned. I think that we can be careful not to allow our freedom to become a stumbling block to others, as it reminds us in 1 Corinthians. And so just looking for ways to serve others and help others that may be struggling. I think it's also an opportunity for us to demonstrate confidence in who God is. I don't have to be confident in what I know or confident in the data or confident that a mask is wrong or a mask is right, but I can be confident in who God is, and that he created me to love other people and to share his love with others. And so I think we can still look for ways to do that. I think also we need to be careful as far as humility goes, that we don't become too dogmatic or argumentative or angry about whether it's our rights being infringed on or our perception of our rights being infringed on, but that we really focus on being humble and being good listeners and being kind. Again, that verse in James really speaks to me, because it's definitely easy for me to fly off the handle or read something that I just disagree with completely. And at the same time, it's not my job to rabble rouse, but it is my job to love others. So how do I do that best? And I think we each have to answer that question before we post or say or react. How can I love others best with my reaction? And then just the kind of a little bit is the countercultural nuance that I don't have to have everything be black and white. It's okay for things to be a little bit in the unknown, and to be complex, and to understand that it is complex. And I think if you go off the tangent, like we said earlier, of saying this coronavirus is no big deal, well, if you say that to somebody who's lost a family member to coronavirus, they're feeling it a lot differently than you. And I think we need to be respectful of that. Even if there's not thousands and thousands and thousands of deaths like we initially were predicting or even thought might happen, there still have been thousands of deaths, and a lot of people have died worldwide. I think the number, I saw one number, I think it's around 356,000 deaths that Johns Hopkins University had calculated worldwide. That's a lot of people. So it is a real thing, and we need to be sensitive to what others may have experienced, and just be okay with understanding that there needs to be a healthy form of skepticism. And I may not have the answer that I want right now, but be patient. And as we analyze the data and more information comes out, we'll have a better response for it. Another verse that I keep glancing down to and have been thinking about is in Ephesians 4. And I think this would be a verse that all of us, again, if we chose to live by this, would be better off. But it's walk in a manner worthy of the calling to which you've been called, with all humility and gentleness, with patience, bearing one another in love,
Mm.
eager to maintain unity of spirit in the bond of peace. And I
Mm.
really feel like that is a great way to respond to any type of pandemic or any type of anxiety-ridden virus, whatever it might be, but that we walk in the manner worthy of which we're called, and that really we're working to bring people together and to be peaceful in how we do it.
Yeah. And I think I think back from Anthony Weber and Terry Porter's conversation I had with him, we talked a little bit on control and how we feel like we're, some of what we had control of before is being lost. But what appropriate things that we are able to control is our emotion and our response back to just kind of what's going on right now. So a lot of what you were saying too just reminded me of that on, yes, we always can't control when a business is open or when we can go and move somewhere, but our I guess faithful response we are able to control as to what we say and what we do to those that are around us. So yeah, great perspective there, Nate. Thanks for sharing, and those verses too are just great reminders for us always, but especially during this time as we might get a little frustrated at times with what's going on.
Yeah, I think all of us, I mean, we all are feeling the inconvenience of the regulations and restrictions, and it is inconvenient. 100% it's inconvenient.
Yep.
But at the same time, we don't have to let that define our response. And I think that's a good reminder.
Yeah. Great. Well, Nate, anything else? Any other final thoughts or words?
Boy, I wish I had some great words of wisdom. I think, I think it's been an interesting time to live. I think we've all learned a lot, and there's a lot more to learn. I think, one thing I actually saw an article today as I was just doing some reading, and it was talking about how the seniors of 2020 have been given an opportunity for something that no other class has been given, and that's really the opportunity to adapt. And I feel like adaptation and the ability to adapt is a very powerful characteristic, and I'm excited for seeing some of how that's going to develop in our own kids. But even as kids step out from graduating college or graduating high school into college and making those big transitions this year, and how they've had to adapt, I think that's going to define a lot of their responses in the future. And it just makes me excited to think about that. And really, I think reminding myself that this is an opportunity to practice adaptation and how I'm going to adapt and react, and hopefully make that a positive reaction and a positive adaptation, and not a negative one.
Yeah, that's great. Well, Nate, hey, I appreciate you sharing your perspective on kind of how it's impacted you and in your hospital and how you see it, just kind of on the medical profession side in the United States. Obviously, I will be curious how it goes going forward as different businesses and churches and schools open up. But yeah, we'll all do our part as we try to mitigate this together. But again, thank you for the work that you do at your hospital. The way in which you share your perspective to people that ask you questions, because we value your perspective as someone who's kind of in the weeds there, right in the thick of it all.
Well, thank you very much for having me, and I appreciate your invitation, and look forward to maybe continuing this conversation in the future once we know a lot more.
Yeah, you bet. Yeah, once the I don't know turns into here's what we maybe do know now, right?
Exactly.
All right. Very good. Well, thank you everybody for watching. Stay tuned for some of our next ones as we continue this series all throughout the summer at TC Christian. Have a great day.
See ya.